everybody, Doc Mackey. I want to talk to you briefly about hemorrhage control. Remember, we have tools in the pre-hospital environment for hemorrhage control. The one we always think about is tourniquets. Tourniquets are applied to an arm or a leg 2 inches above the wound when there's uncontrolled hemorrhage. And remember, if you can't control it with one tourniquet, it's okay to put a second one above the first one. Okay. What about in the trunk? What about the chest, the abdomen, the flank, the back? Well, we don't have good answers for that. That is not a place we're going to do wound packing. Really, the best solutions we have right now is TXA and a surgeon. So, what about those other areas that we have uncontrolled hemorrhage? Rarely you're going to see wounds that are right in the upper arm, near the armpit. You might see wounds in the proximal leg, like where the femoral artery is, or the femoral vein coming out of the hip. Those wounds are going to be rare, but they do exist. And in those situations, and in other places of the body where you have uncontrolled hemorrhage, I want you guys to begin to think about combat gauze. So combat gauze will be located in the ambulance above the bench seat in the trauma, where the trauma equipment is, where you already have tourniquets, you have high-fin chest seals, also potentially in POW kits as well. But what is combat gauze? Combat gauze is the Z-folded gauze. It's really long, but it has inside the gauze a material that helps promote clotting. It also has, and I get asked this a lot, what's this blue squiggly line? Well, the blue line is so that it can be found on radiographs later at a hospital if there's wound packing and the hospital wants to know, did all the packing come out before maybe they go to the operating room? So you may have seen techniques before about wound packing like this one. So this is putting as much of this gauze into a wound as possible, finger over finger, until the wound is completely and totally packed in every single crevice and there's pressure on top. Remember, get as much of the gauze in and then pressure. I want you to also think about the fact that this procedure is going to be very painful, so remember about pain control for your patients. Wound packing is going to be very painful. But because these kind of wounds that I just talked about are kind of rare, where else can you use combat gauze? I want you to think about those situations where you couldn't control hemorrhage. The most common one, honestly, is an elderly fall, maybe in a convalescent home, maybe at a home, but they're on a blood thinner, and they have a laceration of their scalp, and you see that bleeding, and you just can't quite get it controlled. In the past, our urge would be to wrap this with like a turban almost and just put a lot of pressure and as much gauze as possible, but that really doesn't stop the bleeding. When you have those situations, I really want you to begin to think about combat gauze. You can cut this into segments, as much or as little as you want, and pack that into the wound where that laceration is, where it's bleeding, then put pressure on top, and then you're going to be able to control hemorrhage. Don't ever put active bleeding underneath gauze where you can't see it until the bleeding is stopped. You can also use it for varicose veins that pop open, that come in and they're just bleeding. Any kind of hemorrhage that's not going to require a tourniquet, that's not in the trunk, so in the chest and abdomen, the back and the flank, that you need to control hemorrhage, I really want you guys to think about and use combat gauze. It works, it's very effective, it'll stop the bleeding, and your patients will thank you. All right? Hemorrhage control, quick flyby. We'll see you on the next one. This is Doc Mackey.